The Prime Minister, his cabinet response team dealing with the coronavirus, Prime Minister, and as well as the provincial and territorial leaders meeting in Ottawa over the next 2 days to deal with the fallout from the COVID-19 pandemic and, of course, the falling oil prices. To talk about all of this, in Ottawa with me live now is Deputy Prime Minister Chrystia Freeland, not just Deputy Prime Minister, Minister of Everything, and also chairs Canada's Cabinet Response. Minister Freeland, it's a pleasure to welcome you to the program. Thank you for being live with us today.
Good to be with you, Heather. And there are a lot of ministers in our cabinet who are all working very hard.
Well, I certainly know that. We saw many of them yesterday alongside the Prime Minister. And I am going to talk in detail about the First Minister's meeting in just a minute or two. But if I would like to ask you first a couple of questions arising from the headlines we're dealing with this morning. Number one, people in this country are waking up to the news that the WHO has now officially declared the coronavirus a global pandemic. What does that change for Canada and for Canadians?
Well, I think the declaration in and of itself is an observation of fact, of the reality that this is a virus which is now present in more than 80 countries around the world. I think that we need to be honest with Canadians, and we are. I would really urge Canadians to listen to medical experts. We have a fantastic chief medical officer. And what experts are telling us is that this is a serious situation. It will get more serious before it gets better. And what I also want to say to Canadians is the federal government will do what it takes.
Well,
First
we heard
and
that
foremost,
loud and clear
when it
yesterday
comes to protecting the health and safety of Canadians, and also to keeping our economy strong. And just one final thought, Heather, if I may, which is, I think we all need to do what we're doing, which is understand that this is a serious situation and we all have a part to play. It sounds so simple, but all of us need to wash our hands a lot. All of us need to stay home if we are unwell. And I think really people are doing that, and we need to do that to take care of ourselves, but also to take care of our neighbors.
Okay. We got that message from you. We got that from the Prime Minister yesterday saying we're on it. We're on it together. We get it and we're on it. But even though this declaration it's really symbolic, as you said, an acknowledgement of reality. It doesn't have any legal imposition. It doesn't require any new measures. But you did hear loud and clear from the WHO Director General that this is an attempt to galvanize the world. And he urged Canadians to double down, to be more aggressive and to focus not just on containment, but really on mitigation. And I know that has been a focus for Canada, but I'm wondering again, with this new WHO directive, how, again, does this affect Canada's strategies, Canada's priorities?
Well, I think the message to us, all of us, is to keep on what we're doing, and exactly as you say, Heather, to double down. This is a serious situation. We need to take it seriously. We are taking it seriously. In about an hour and a half, I will have my daily call with all the members of the Coronavirus Cabinet Committee. We will then have a meeting this afternoon, our second meeting this week. Coronavirus, I am confident, will be an important issue that the Prime Ministers and Premiers of provinces and territories and Indigenous leaders address later today and tomorrow. So really, this is a serious situation. We need to take it seriously. I really believe Canadians are doing that. It needs to be a whole of country response. It is. So we just need to keep going, support each other, and really be ready to do what it takes to make sure Canadians are healthy and safe and to support our economy.
I will get to that meeting in just a second, but I do want to ask about what we learned last night in the national address from U.S. President Donald Trump. He announced a travel ban, which will block most ministers. No, that's not true. He will block most visitors. I'm sorry. A travel ban to block most visitors from continental Europe coming into the United States for the next 30 days. It's his most aggressive action yet. Did the United States inform Canada in advance of announcing that?
No, they didn't.
So what was your reaction to hearing it then last night?
Well, I immediately got in touch with Kirsten Hillman, our outstanding acting ambassador to the United States, and she has subsequently been in touch with our U.S. counterparts. The Prime Minister will today be speaking to his G7 counterparts, and I will be speaking to my U.S. counterparts. So, this is absolutely something that we need to discuss with our friends and neighbors, and we will be doing that.
What we hear from many of our viewers is a question about whether Canada should do something similar, whether there are any plans to do the same. Will Canada do the same and institute this type of travel ban?
So when it comes to what Canada is doing with people traveling into our country, we are constantly reviewing what is happening at Canada's border. We already have enhanced screening in place for people arriving from countries where there is an outbreak, a bigger outbreak. Coronavirus is now all over the world in more than 80 countries. But in countries where there has been a larger outbreak, we already have enhanced screening in place for travelers from those countries. And we are constantly reviewing what we're doing at the border. I would like to add two things to that. One is, for Canada, the government's approach is to be guided by the advice of medical and scientific experts. We think that is the best way to protect the health and safety of Canadians. That's the approach that we are going to take. The other comment that I think I would like to make when it comes to the border, something for Canadians to reflect on, is our single largest border is, of course, our land border with the United States, and there are 400,000 people who cross that border every day.
Well, that is feeding right into my next question, because one could foresee, if Canada doesn't suspend flights, incoming flights from Europe, similar to the United States and using the same time frame, could you not foresee the United States closing that land border because someone could potentially fly into Canada and then drive into the United States to avoid the U.S. travel ban?
So I believe in never making predictions in public about anything. I don't think that's a good idea. And I would certainly never make predictions when it comes to the future behavior and decisions of other countries. We do have
No, but it was a question about whether Canada will be required or will have to respond in kind with a similar ban because of what might be the United States response.
No, it was a question about, could I foresee the U.S. doing something? So what I will say is, it's very important for us to have a good conversation with the U.S. about our shared border. I spoke on Monday with Mike Pompeo, the U.S. Secretary of State, and we spoke about the coronavirus. We spoke about our shared border. We spoke about what is happening with the price of oil and the North American oil and gas sector. So we have a good and close relationship. You're absolutely right that it's important for us today to continue the conversations that officials began last night with our American partners and neighbors about our border, and we will do that.
You will be also having these important discussions starting today with provincial and territorial leaders, and I know in advance of these meetings you had written to the leaders and asked them for reports in terms of their state of readiness, in terms of their concerns about any gaps. What did you hear back? What is the overview as you begin this discussion?
That is a great question, and I'd like to start by saying that the conversation between the federal government and the provinces when it comes to the healthcare response to coronavirus has been happening for more than 2 months. There have been weekly calls of the health ministers for some time. So we have been working already in close touch with the provinces. And something we've said to the provinces that I'd like to say to Canadians is, we are not going to quibble in this situation about what is a federal responsibility, what is a provincial responsibility. The $100 billion coronavirus response package that the Prime Minister announced yesterday includes $500 million for healthcare. So we very much understand this is an area where federal leadership is required, and we have already launched a bulk procurement effort led by the federal government. I'm not going to go into details of what we heard specifically from the provinces, but I can tell you that we have, since that letter was sent, had conversations with provinces, including with premiers, where they have said they really welcome the opportunity that they'll have tonight and tomorrow to talk directly with the Prime Minister about how we can work together.
Okay.
And what we have committed to do as a federal government is to be there to fill in any gaps, to meet any needs that provinces have. I think it's very important for frontline medical professionals to know that they will be able to do everything they need to do.
And at the end of this, of course, we'll be keen to hear more about that $500 million commitment. We were taking that live as you were making that announcement, Minister Freeland, and also what the premiers say about this whole of country approach that you have called for in terms of getting all of the premiers to buy in and have a national strategy to controlling coronavirus. I do wonder, as I leave you today, I know you have other interviews to do, so one more question, although I have more, but hopefully we'll have another opportunity. A question about even holding this event, if you will. Yukon's leader is not attending. New Brunswick's premier has expressed concern and suggested instead a video conference. What safeguards are you taking to ensure that the vast majority of this country's political leadership are safe and healthy and don't end up with coronavirus as a result of this gathering?
It's a good question, and let me start by pointing out it is not a very large gathering. And the public health advice is, in general, that we need to be most thoughtful about larger gatherings, and that is important to bear in mind. I think it will be important for all of us to do what I have been doing starting this morning, well, for days now, but this morning, we really need to wash our hands. I think we need to be thoughtful about social distancing measures. So now I am going to be offering my elbow to the premiers when I meet them, and a smile of welcome rather than a handshake or a hug. I think we all need to be thinking about that. And really importantly, anyone who feels unwell needs to stay home from work, whatever your job is.
Some of your cabinet colleagues doing just that as they await word, as they've been feeling unwell. I appreciate the time and certainly look ahead to what you're going to be discussing. Very important matters. As we know, Canadians' concerns and anxieties are only increasing with the spread. Thank you, Deputy Prime Minister, for the time today.
Okay, thank you very much, Heather. And if I could offer a final thought to Canadians, which is, let's keep on doing what we have been doing, which is listening to the medical experts. Canada is fortunate to have an outstanding healthcare system and fantastic medical professionals. They need to be our guides as we go through this.
Important to keep in mind as well. Chrystia Freeland live in Ottawa this morning, and again, our thanks to you.